Cancer is no longer a distant health issue. It's a growing reality affecting women across ages, religion, and socioeconomic. The awareness, timely screening, accurate diagnosis, and personalized treatment can dramatically improve outcomes. Join me in welcoming our speakers for this panel on breast cancer awareness, which is an initiative of Voice of Healthcare. Understanding breast cancer awareness, screening, diagnosis, and treatment. So we have with us Dr. Jasmine Purwal, consultant medical oncology and breast cancer specialist, Delhi. Welcome, Dr. Jasmine.
Hi, thank you.
Dr. Mukesh Bang, senior consultant medical oncology, Max Healthcare, Nagpur. Welcome, Dr. Mukesh.
Thank you, Dr. Manisha. Thank you very much.
Dr. Jeyhan B. Thabar, consultant medical oncology with special interest in breast cancer, Shanti Mukund Cancer Center, Ahmedabad. Welcome, Dr. Jeyhan.
Hi, I'm from Jaslok, Mumbai. Just a minor correction.
All right. My bad. Dr. Ankit Patel, Director and Senior Consultant, Breast Oncology, Surat. Welcome, Dr. Ankit. Can you hear me, Dr. Ankit? I think there is some audio issue. Ms. Soumya Rajesh, Indian Cancer Society, Delhi. Welcome, Ms. Soumya. Hi. So my first question is for Dr. Jasmine. What are the key risk factors and early warning signs of breast cancer that women should be aware of today, especially younger women?
So, one of the signs I think more we should look out for is asymmetry in the breast. So, you need to have a look at your breast and you feel that one of your breasts is maybe pulled up or pulled down. That is one of the very early signs of breast cancer. The other one, which are more advanced signs, is maybe some skin dimpling or some orange peel-like appearance of the skin or nipple inversion or retraction or discharge of the nipple. These are quite late stages. If the cancer is detected in this stage, then the cancer is already quite advanced. But one of the early signs would be any lumpy, bumpy feeling of the breast and any asymmetry in the breast. And most of these lumps which you feel in the breast, they are painless. If it is more towards malignant, then they tend to be painless rather than being painful.
Taken, I think, seriously, and they should be properly investigated to know whether they are benign or they are malignant. So, Dr. Mukesh, from your clinical experience, why do some women in India still present with advanced stage breast cancer despite available screening tools?
Thank you, Dr. Manisha, for the excellent question, which is very important and valid questions at this point of time. So the problem comes at a multiple level. First is the socio-economic status of the patients and family. In India, if we talk about cost, is always the concern because at a rural population where they are at a very rural area, tribal area, they don't have a radiology facility, and then they have to travel somewhere and then go and do their mammography, MRI, CT scan, PET scan. So automatically they have a cost burden. So they try to avoid. That is the most important in a rural population. Second comes with the socio-cultural stigma where the patients and family they feel कि if गठान है इसका मतलब कैंसर हो सकता है कैंसर हुआ तो कुछ भी हो जाएगा so they don't go and they don't show and that is a very important and very practical point. And third is the number of people and the surrounding areas in a rural population. If you see, there are so many guidance given by the many of the other therapies and all those things. They say नहीं ये ऐसा नहीं है वैसा नहीं है कुछ करने का काम नहीं है मैमो किया तो रेडिएशन का इफेक्ट आ जाएगा. So ये बहुत सारे there are so many factors which come in a basket, and with this all basket filled of all myths and the cost and socio-cultural factors and stigmas, it gives so much of hurdle for the patient to come to the clinician. And once the patient comes to the clinician, then there are some other problems like if they come, then they shyness showing to the consultant, and they are very hesitant being female. They don't want to show examine, and even if you tell them, they will be very hesitant to do. Afterwards comes the infrastructure. Same in the city, if you talk about even at the taluka level, also you don't have the facilities available for the mammography. They, even consultant don't know. So these are major hurdles which comes when we diagnose patients. And among this, the most important is the cost and the screening guidelines. See, many of the people, they don't follow the screening guideline. It is only the screening guidelines are followed. It's only as called as a opportunistic screening guideline. That means अगर आपको तकलीफ है then you go for the screening. Otherwise the proper screening जो होता है वो इंडिया में बहुत कम टाइम फॉलो किया जाता है. अगर फैमिली में किसी को है then the next person will try to do and see. Otherwise even if you talk about the educated girls and women and the urban population also, you go and ask anyone whether they are doing screening or not. So 90% of the still ladies, they are not doing screening because they are trying to do the opportunistic screening, not the proper systematic screening guidelines. So these are very important aspects and points which are creating troubles for diagnosing at an early stage and giving benefit to them. If you see this, even if you see the mammography screening percentage, it is very less because nowadays we are seeing more young breast cancer in the younger female because they have a dense breast, and the mammography, the percentage of getting the diagnosis is less in the younger dense breast. So automatically we need more techniques where we need MRI and other modalities to understand. So anywhere, if you talk about cost and socio-cultural stigma is the one point which is giving a trouble for diagnosing at an early stage of breast cancer.
I think the awareness is much needed, and early detection is what should we aim at. And definitely, we should burst these myths and get the screening done at mass level. Dr. Jeyhan, at what point should women move from awareness to medical evaluation, and what does an ideal early diagnostic pathway look like?
So I think there is no point of time which is correct to say that from now we move from awareness to medical evaluation. It's a continuous process, I would say. So only if you are aware, as Dr. Mukesh already mentioned, only if you're aware about the symptoms, you will contact the doctor at the right time, number one. But now, thanks to social media and the access to information, many patients are aware that this could be something dangerous that they're harboring, that this lump in the breast can be something sinister. Many patients are aware, but people are still not aware that if breast cancer is detected early, it's very much curable in most cases. They feel, कि, oh, this is cancerous and it's a death sentence, it's the end of my life now. It's absolutely not true. Breast cancer is so treatable now. It's so curable, I would say, if detected early. So that fear should be eliminated. I think that is very important. So awareness, yes, that is setting in, but the awareness that treatment is there, that is still lagging behind. And the ideal scenario would be a lady coming to me with a very small lump in the breast, which she recently felt 15, 20 days back. I biopsied, and as per the tumor marker, as per the ERPR, HER2 status, I send it to a surgeon or I start treatment right away within the first month of the symptom. That would be an ideal scenario.
And Dr. Ankit, how important is timely screening in improving treatment outcomes, particularly in tier 2 and tier 3 cities? Dr. Ankit, can you hear me? That's one thing.
Yeah, yeah. Now
Yeah, please.
the technical issue is resolved.
Yeah.
Particularly when we are talking about tier two city, nowadays we are no we are in Surat, so we are now near we are in metro. So here the awareness is very much high because of an social awareness. Even a vaccination program is also done very aggressively at the society level, from not from the medical agency but by the local social group. And mammography also routinely done by many time of free of cost in many camps in the Surat city. But particularly in village and peripheral area, definitely the people are not aware already. Previous doctor says that we are facing many difficulties to understand the things. Even we also saw some doctor family also they are hesitant to do for mammography. I am not talking about uh, normal people because of a myths of mammography do exposure to much radiation may lead to secondary malignancy. So in tier 3 city definitely, and in taluka level and village level there is require more awareness regarding the regular screening. And definitely all we know when we identify the tumor in a very early stage, there are very high chance of cure, and also many times the patient get rid of cancer without having an intensive therapy. Because many times we saw a relative who diagnose the cancer, they go for the mammography, they identify the tumor in situ condition, means stage 0, and they get rid of the malignancy, with only with surgery, without doing much any further treatment and oral hormonal therapy. So the rightly Dr. Mukesh says previously, the opportunistic screening is much more in India. After the one relative diagnosed, the people we go for the secondary screening and they identify the early cancer. Tier 3 cities, definitely there are very hurdles. Even in vaccination program also, they are not ready to take the vaccine for young girls for cervical cancer. We have to much aware. They are very some worry for the side effects and many minor things. But after counseling, we can get rid of this their belief. And even in my own village, we have done vaccination program and we have got a good response.
That is much needed, rightly said Dr. Ankit, and awareness is something which we should aim at. And you rightly mentioned that there are certain vaccination available, like human papillomavirus vaccine, that should be given to young girls to prevent at least the cervical cancer. And for breast, I think early detection is the key, and we should definitely stress on, screening. So, Ms. Soumya, I just want to know that from the patient support lens, what emotional, social, and cultural barriers most commonly delay women from seeking screening or care?
Yeah, so for women, I think even if the awareness is created, uh, for them the family comes first. So their health is in the bottom of the ladder for them. So even if the awareness is created, people should come out. That is what I would say. And there is, of course, it is concerning breast. So women, for women, it is the most feminine thing, and that shame, embarrassment, all these things plays a very important role in coming out. I think there the family should support them, that it's okay when I have seen people when we go for emotional support to hospitals. I've seen people, even professors and colleges, they come from their state to Delhi for their treatment, leaving their kids behind. Why? Because they don't want their kids to know that that their mother has breast cancer. So this is the type of stigma that we have in our society. And of course the financial burden are there for people who are not insured, or are not in panel. They just stop in between and they go for other remedies. And by the time they understood that this is it has become later stage, it has reached the later stage, it will be very bad state. And also the yeah, these are the things. I mean, one another thing is a negative social thing. Google and WhatsApp messages that chemotherapy is not good, radiation is not good. So these are the myths that we should change, and this social stigma should be changed. Then it can be detected early.
Dr. Jasmine, can you hear me?
Yeah, I can hear you.
Yeah, okay. So, Dr. Jasmine, once cancer is diagnosed, say in breast, how do you help patients understand their treatment options and cope with emotional impact of the diagnosis?
So actually, we have to be upfront with the patient in the beginning itself. Depends on the stage of the cancer. We are able to define the treatment for the patient, like what would be the role of chemotherapy, role of surgery, radiation, and so on and so forth. If the patient is in the early stages, we do tell the treatment plan. Mostly, it lasts for about a year, the complete treatment. And if it is in the metastatic stages, then also we are able to tell the patient that the patient will be on some kind of treatment for lifelong, even when the disease is under control. It is very important to make, especially the ladies, understand that if they are detected with cancer, it's not the end of the world. And since there's so many awareness programs and A lot of the times, the lump in the breast or whatever it is, the patient does come to the doctor seeking help. So many of the cases we are able to detect in the stage 1 to stage 3 stage itself, and in those cases we're able to offer 100% cure to the patient. So I think this is quite important for the patient to know from the beginning as to what are the goals of the treatment, what are we looking at, depending upon the stage of the patient. And accordingly, I think most women, I haven't seen here, at least in the metro cities, patient dropping out from treatment and not taking it. Especially if it is curative, it is all the more easier to convince the patient. But otherwise, also patients are like receptive to taking treatment, because since the outcomes have improved and patients have heard a number of their own relatives or friends who've taken treatment and they're doing well. So many patients are forthcoming if they have the necessary social support as well. I think that is very important, as the previous panelist also mentioned, that family support is very important. I have seen in all cases in which they have decent family support, at least from their husband or from a brother or some male member in the family, then they are able to go ahead with the treatment and actually be continue on it as well and not drop out of treatment.
I think support is much needed from the family as well as, from the
Uh,
clinician, from the society.
Yes,
And
and as like while we're treating the patients, this is one problem. I think oncology or other cancer is one treatment in which it requires a holistic support, not just from the maybe the patient himself. He requires somebody for financial support, somebody to take out time from their work and come with them to the chemotherapy or for surgery, and take them for. I mean, if the discharge is like done, then somebody do the paperwork. Then obviously they need help from the clinician, from the palliative care specialist, somebody to help them guide the nutrition. So sometimes some centers also have psychologists helping out patients with oncology. So it's quite a holistic approach. I would definitely like to say it's a team effort. One person cannot do it alone. Even the patient cannot do it alone. They do require support. We also require support while managing such cases.
Ish, how have treatment approaches for breast cancer evolved over the years? And what improvements are you seeing in patient outcomes nowadays?
Uh, is this question for me?
Dr. Mukesh, I think,
So
yes.
I think thanks to the science and all the trials and evolution which has happened, the theme for the World Cancer Day is United by Unique. That means now, previously, one size fits all. It's not the rule here now. Every cancer patient is different, and same thing when we come to the OPD, people talk, अरे उनको तो हार्मोन की गोलियां ही दी है सर, 5 साल की आपने तो मुझे कीमो दे दिया है. सम पेशेंट से कि सर उनको कीमो दे रहे हैं लेकिन मुझे गोली क्यों दे रहे हैं. सो आप मतलब मेरी क्या फोर्थ स्टेज है क्या मुझे गोली दे रहे हैं. सो दीज आर ऑल द क्वेश्चन विच कम्स इन ओपीडी. सो one size doesn't fit all, and all treatment modalities are different, each stage is different, and the advances in the treatment, including the surgery, from radical surgery to the breast conservation, and plastic surgeries, and then nipple sparing surgeries we have. Then we have radiation, where you can avoid the complete whole breast radiation. There are different technical parts of the radiation techniques which can be accommodated, avoiding the side effects. Then comes with the chemotherapy, immunotherapy, targeted therapy, and hormonal therapy. These are the huge and major advances which has happened in a breast cancer, and quite successfully we have made stage 4 breast cancer as a chronic disease. So if you talk about the everyone says कि नहीं incidence बढ़ गया है, cancer का incidence बढ़ गया है, but I always say the population also has increased. So if you check the numbers according to the population, it is, I think, it is equivalent. But if you see the mortality, it has decreased. Survival, it has increased because of the advances in the treatment which we are giving. पहले हार्मोनल थेरेपी से थोड़ा बेनिफिट होता था. Then we have the oral CDK4/6 inhibitors. Then we have a HER2 therapy. I know Cost is always the issue. People says ki breast cancer ki therapy बहुत महंगी है, but then automatically someone is having a HER2 positive gene, and the government is not providing the HER2 targeted therapy drugs, then definitely patient has to pay and take the therapy. Fortunately, right now the trastuzumab is available in the Yojanas and the MJPJY and Ayushman Yojana. At least previously patient were not able to take trastuzumab. At least they are able to take trastuzumab right now. But then we have advances in newer drugs coming in the basket, and we cannot say that these drugs should be at a cheap level. क्योंकि वो जो इनोवेटर ड्रग है, that has its own importance, and definitely the generic molecules cannot replace the innovator brands. That is true, that I think all medical oncologists will agree and everyone will agree. But the point is, if patients are not affordable for the innovator brand, at least you can use the generic which are available and try to prolong and improve the survival. So one point is surgery, second is radiation, third is chemotherapy, targeted therapy. With the advances of immunotherapy and excellent responses in triple negative breast cancer, I think
Dr. Mukesh? Yes, there is some network issue. Dr. Jeyhan, I think he was telling us about different.
Can you hear?
Yes, yes, Dr. Mukesh. Please carry.
So, with the advances in all the treatment in early stage cancer from 80 to 90%, we have come to 98, 99% survival, 5-year survival. Even in advanced stage, we are now able to make a hormone positive disease as a chronic disease. We have HER2 positive patients who are taking treatment for 5 years, 6 years, even in advanced stage situation. I'll tell you, pertuzumab, maybe every medical oncologist has experience. One patient who is a lecturer in stage 4 disease in 2020 with liver metastasis, still taking pertuzumab as a drug, and received 100 doses of pertuzumab, and still the PET scan is bang normal. So this is the advances which we see with the medical drugs. लोग बोलते हैं कि मेडिकल ऑन्कोलॉजिस्ट बहुत महंगे हैं. They always give fancy drugs. They always say कि कुछ नए ड्रग्स बोलते हैं, कुछ नए ड्रग्स देते हैं, but that is all our experiences. अब हमारा एक्सपीरियंस है कि अगर कोई पेशेंट 100 pertuzumab ले रहा है, that means other patient who is coming new, we will be telling that person also to use this drug. You may come in that 100 and you may have a survival of 5 to 10 years. No one knows anything. That's the reason one size doesn't fit all, and unity by unique is that's the reason it's a theme. So every patient is different, and we are using different modalities of treatment in different cancers. We are dividing the breast cancer into different stages and different subtypes and treating separately. And that's the most important point. We are able to make even a stage 4 breast cancer a more chronic disease, giving more duration of prolongation and survival with maintaining good quality of life. We are not like we are just torturing the patient by giving chemotherapy. If you talk about hormone positive, only hormonal tablets patients are taking since 4 year, 5 year. They are just coming, doing the CBC or the counts and all those things, and they are taking the tablets. If you talk about HER2 positive, definitely cost is always a concern there. But if the patients can afford, they can continue the drug for a long period of time, and they can improve the survival. So that's what we are. I think we are quite ahead from what we were 20 years back, but still we need more drugs, and we need more support from the government to incorporate some of these drugs, important drugs, in the government setting or the hospitals. So that's the situation we face as a medical oncologist. If someone comes in a OPD, if HER2 positive is there among 100 patients, if someone comes in a trust or government hospital, I don't feel ki 95% of the patients are taking pertuzumab or any other. They are just able to take trastuzumab because it is available in Yojana. But if same setting, if you go to the private hospital, and the patients are taking that drug because somehow they can pay the drug and they can take. So in that way also the survival has changed between the government trust hospitals and the private sectors. So that is also a difference, the different survival in the hospital settings.
Like he said, we have different options for the treatment of breast cancer patients, and thanks to that, the survivorship has increased. And if anybody is diagnosed, definitely they should get it treated at the earliest. So, Dr. Jeyhan, could you explain the role of molecular profiling and personalized medicine in deciding the most effective treatment plan? Dr. Jeyhan?
Hello.
Yes, I can hear you, Dr. Jeyhan. Do you want me to repeat
Sorry,
the question?
yeah, because I could not hear you. Sorry.
Okay, no issues. So we have been discussing about the various treatments, which are available for the breast cancer patient, and definitely because of the advanced treatments now, the survivorship is more, and we have better results. So could you explain the role of molecular
I'm
profiling
sorry, your
and
voice is
personalized
dropping
care?
midway. I can't hear you.
Okay. All right. So I just want to know that what is the role of molecular profiling and personalized medicine in deciding the most effective treatment plan? Dr. Jasmine, are you there? Dr. Jasmine? Dr. Jasmine, can you take up this question? Yes, Dr. Ankit. Dr. Jeyhan is there. Okay. So, Dr. Jeyhan, could you tell me the role of molecular profiling in deciding the treatment for breast cancer patients?
Yeah. So I think molecular profiling has taken a major place in oncology, and it has really changed how we treat cancer overall. Not only breast cancer, I'm saying across cancers. It's something really game changing. So in breast cancer, right from the initial stages, molecular profiling, next generation sequencing comes in a big way. So there's a simple test called Oncotype DX. Of course, it's very expensive. That's a major drawback, but there are some Indian equivalents also. So in early breast cancer, in a certain subtype of early breast cancer, we can absolutely avoid chemotherapy for certain patients based on these recurrence score tests that we have. In advanced breast cancers, in triple negative breast cancers, which are considered to be really aggressive, and where we have limited treatment options, immunotherapy has also come in a major way. Across breast cancers, we have germline testing, which is a very important aspect, where we a simple blood test which helps us detect if the patient has an underlying genetic mutation. For that has two implications. One, of course, is we have excellent tablets to offer these patients to control their cancer, and as well as that, we understand the family's risk for cancer as well. Are the future generations at risk? So, for genetic profiling, for treatment in early stage, for advanced stage cancers and hormone receptive cancers, for ER/PR positive breast cancers, we have newer molecules, newer therapeutics coming in. Like for PIK3 positive, we have a new targeted therapy. For ESR1 mutated breast cancers, we have newer treatments. So I think across the spectrum, from early to late, in breast cancer and across cancers, molecular profiling is extremely important, and it is game changing.
Dr. Ankit, how do you balance treatment effectiveness with quality of life, especially for patients undergoing long or intensive therapies? Sir, unmute yourself.
Sorry. Definitely, we have to also balance the quality of life whenever we plan the treatment for the cancer patient, because most of the patients are going for prolonged treatment. Many time, many minor side effects, as we can say, if a patient is on AI inhibitor, one type of hormone therapy, they have many of patients complaining of fatigue and joint pain, which is many times they ignored by the patient themselves, also sometimes the oncologist. So these are minor complaint we always ask to the patient. Okay, whenever it is low, although they have very less for side effect, but some patient getting a very severe arthralgia, means body pain and joint pain, we have to change the drug. Then we can definitely get rid of side effects. So quality of life definitely matter. Only Dr. Jeyhan says many times in early breast cancer, particularly for the specific subtype like the strong hormone positive early stage, we can do Oncotype DX or Indian equivalent test to avoid the chemotherapy. So ultimately, it is also going to decrease the side effects profile of all oncological treatment. Many time we can also reduce the radiation doses. So ultimately, the skin toxicity and later on the lung and cardiac toxicity we can avoid it. So quality of life we have to also maintain, and many times also we involve the nutritionist and meditation guy and psychologist to the patient to maintain their apart from physical mental health also. So by whenever necessary, reducing the drug doses and reducing the duration, we can help the patient to maintain their quality of life.
Right. And Ms. Soumya, after treatment, what kind of support do patients and caregivers need the most, and how can communities play a stronger role in survivorship?
Yeah, it's a very important thing. This after in the survivorship, after treatment, I think none of the patients are told what happens after the treatment. We all think during the treatment you will be okay. So we are in a very positive. Even as a patient, I know I was very young. I was just 40 when I was diagnosed, and so I had so many responsibilities in and around. So my only thing was to get back to life. So, but after the treatment, uh, I think it was after the treatment that I had more problems than during the treatment, because that I was not able to get back to normal life as at the pace that I wanted, and then with all the medicines and everything that was chemopharmacine, which I didn't know about it, and about, of course, the edema. I mean, I was asked to do exercises, I didn't know about for what. So these are the things which I think the patient should be aware of, because after the treatment, if you tend to know all these, you are into going to depression. And here is where I think the support groups play a very important role, not just for the patients, even for caregivers, I should say, because even they have gone through so much of things to looking after their dear ones. So when we as emotional support groups go to hospitals, we talk with patients, we do tend, because as a survivor I can tell them these things might happen. It's only might happen, like Dr. Mukesh said, it's not this thing should happen to one patient, or if it has happened to me, it need not happen to someone else. But patients should be aware of all these things. And in my case, I would say after 2 years, I mean, I was almost into depression because of all these things, and I joined Indian Cancer Society. And when I joined there were many people, many survivors there, and so I could understand what was going through me, and that is how I slowly built up a new life, actually. So after the, I mean, patients should be made aware of what are the uh, negative sides. I mean, I won't say it is a negative part, but at least about the long term problems that they could face after the treatment.
You're playing a very major role because treatment is one aspect, but I think the emotional support and this kind of support which you're telling, wherein the counseling can be done, of the patients who are going through the same thing as you went through.
And especially with young patients, they have their kids with them, they have to look after. So it is when you, as I said, there are people who leave kids behind just to make sure that their kids doesn't know about it. So these things, only if we talk with patients that it is okay, it is not to make kids to sit with you. These things you have to talk with them, otherwise people, I mean, they won't understand those things. So as someone who has gone through all things, and I stand in front of them, then they'll be more happy.
I think,
Right.
can I add, Dr. Manisha, can
Yes,
I say something?
definitely. Yes. Yes,
So,
yes.
Soumya madam rightly said, the problem comes, matlab, during treatment, everyone is around you. So everyone will be coming with you for the doses. Everyone will be sitting besides you, and they will try to do everything, whatever, to make you happy. Once you finish the treatment, everyone is going to their own work. Everyone takes their own path and they go out because they know the treatment is finished. So, and the doctor also feels that treatment is finished, and no one takes care of the psychological and the whatever the mind is going on for the patient. And that's the area where your yoga, meditation, and your core group, which comes along with you, like mainly the friend circle basically, because family supports will be there throughout when you take the treatment. And once you finish that area, and once you come to the area where now you are alone, you have started your working, then automatically every day the process will come. यार मेरी treatment हो गई है, whether I will have a recurrence or not, what problems I am going to face. So you need two three things there. You need to get busy yourself with your passion or work, whatever you feel and you like. Second thing, then you have to have a circle which gives you a positive thought process. And the third one is yoga meditation, which comes in the basket. And definitely you should take help of those areas. And we always tell to the patient's family to take these helps to not to go into the depression. And absolutely right what you have told, it's a big point. No one takes care. Even doctor, as a doctor, we treat, and once we finish, we take this tablet and go home. But we don't discuss that what the mindset is going on. And actually, that aspect also should be treated by the doctor. It should be counseled by the doctor, psychologist, and everyone comes there to take care of the patient.
Right. So there is some network issue, I think. So I think we have been discussing about the emotional support. We have been discussing about the neuro treatment, precision oncology, molecular profiling. But what is needed is the early detection. I want each one of you to suggest at least one thing which would definitely create awareness amongst the public listening to us, and so that they should make use of the screening programs that are, going on in our country, and there should be, early detection so that so many lives can be saved. So I think I'll start with the Soumya, you first. That do you want to give any suggestion so that people should seek early detection?
Yeah, awareness is the key. And with all the medical advancements that is happening, I think I hope one day cancer will be as treatable as a fever. That is my hope. And all the everyone who's listening, I just want to please don't refer to Google or any WhatsApp messages when you have very good doctors around you, because that actually people go into some other mode. You don't need the treatment. It can be clearly. I mean, take proper guidance, and then it is very much recoverable.
Right. And Dr. Ankit, what should we do to enhance the prevention and early detection as far as the breast cancer is concerned? Unmute yourself.
Particularly, we all know we have to focus more on prevention rather than the treatment part. So, public awareness is must. It is very much detail is available on social media also by the many oncologists, many eminent cancer institute, how to examine the breast. And at least I will suggest all women should go for self breast examination every month. And after 40, at least should go for mammosonography. Nowadays, many camps are arranged by the many cancer institute and a trust. So finance is nowadays not a concern. Many institutes are really arranging the camp. So we can go to attend that camp and go for the cancer screening at least every year. If it's not possible, then at least every 2 years. Today in also parliament before 3 days, the breast cancer was discussed. In India, having a many women are suffering from the breast cancer, particularly from UP and Bihar. There were around 22% increase in incidence of breast cancer. I think it's because the breast cancer which was not there before a decade in village. Many women are died because of cancer, even unnoticed by the government also. So maybe whatever the reason, but breast cancer is also a big topic in parliament also in this winter session. So it's also concern because we know the woman is a pillar of the family. So we must have to save the women. So women, they have themselves to be educated how to examine their breast and how to go for the screening after 40 regularly, at least every 2 years, so we can diagnose the cancer in early stage and prevent. And the second thing, secondary causes of cancer, we have to focus on our diet. Obesity should be controlled. A diabetic patient should have a well controlled diabetes and should avoid the addiction. This is also another point. The all women have to take care.
Dr. Mukesh, any suggestion how we can, enhance the early
So,
detection?
first of all, as the previous panelist was talking, I think I always have a thought process that a happy woman in the family is the happy family. So that's my key point. And for me, I have been in a joint family, and I have all those things. But ghar mein agar, if the lady is happy, healthy, all family members are happy and healthy. So I think the lady should take care of herself, and the family member should also take care of that lady. That is a very important point. Everyone is working, nahi nahi tu tujhe ye kaam karna hai, they assign something to that particular person, and they don't help them. So that should come out of that. We should come out of all these boxes, and everyone should work together, and everyone should help each other. And it's not like कि just नहीं नहीं कुछ हो रहा है क्या छोड़ दो. It's not like that. You have to take care of her first, because she is the pillar of the family. If she is destructed, everything is destructed in the family. So that's the main point. And I think I cannot use some words here, but अगर ये ऐसा होता है कि दुनिया गई तेल लेने, the lady should take care of herself first. हस्बैंड है क्या, तू चाय चाय जब बाद में पी लेना, पहले मेरा मेमोग्राफी करके आना है मुझे. बच्चे, तेरी एग्जाम एक दिन नहीं हुई तो चलेगी, कुछ नहीं होता, तो पास फेल हुआ तो कुछ नहीं होने वाला है. बट अगर मुझे कोई तकलीफ होगी तो देन तू एग्जाम ही नहीं दे पाएगा. So these points, I think we should know, and we should understand the priorities and the importance of lady in the family. जब ये समझ में आ जाएगा ना, नो सोशियो इकोनॉमिक स्टेटस, नो कॉस्ट, नो सोशियो कल्चरल बैरियर्स, नथिंग विल कम. सब चीजें वैनिश हो जाएगी. Automatically the patients will come, family will bring the patients, and they will get screened, and then automatically your survival will improve. So take care of your own health. Other screening guidelines, as the previous panel told, screening guideline, health measures, and what are the lifestyle modification already told by the Dr. Ankit. And my point is, take care of your whole. दुनिया गई तेल लेने, पहले खुद के बारे में देखो, खुद को चेक करो, एवरीथिंग स्क्रीन योरसेल्फ. इफ यू आर फाइन, देन गिव टाइम टू अदर्स. एयर फ्लाइट में आप जाते हो तो सबसे पहले वही बोला जाता है, पहले खुद की कुर्सी संभालो, पहले खुद को देखो, बाद में तुम बाजू वालों को देखो. Whosoever it is, your husband, your kids are there, your mom, dad, in-laws, anywhere, but they comes later. You are yourself first, and you take care of yourself first. That's all.
Right. I think we should prioritize our health, and rightly said that woman is the pillar of the family, and they should prioritize their health and get themselves screened, because this is something which is much required. And after the age of 40, mammography should be done. And before we close this session, I think all of you, if you want to convey any message or burst any myth around breast cancer, which would be beneficial for the public listening to us, that would be great. Ms. Soumya, any myth or any message you want to give to the public?
Yeah, it is. And breast cancer is not something that that has come because you have done something wrong. That is one that please don't feel guilty that you are diagnosed with breast cancer. It has come, so let's face it. Be bold. That is the main thing. You should have that strength, and to the family also, just give that support, and then you can conquer that. No issues about it.
Dr. Ankit, I want you to burst one myth around breast cancer, because you being the clinician, you must be, their, thought process.
Definitely, Mrs. Sonia says rightly, because many times the cancer diagnosed in the family, the females feel like a guilty, but it's not like that. Even nowadays, cancer incidence so much increased, so in society also guilty feeling is now, it is very much less, but previously it was there before 1 decade, because many, as previously discussed, women was disclosing the cancer to their kids and in nearby family member also, because many time there will be going to hamper their future child marriage, and many things will going to happen if the someone will identify that they have a cancer in the family. So, but nowadays their cancer is so much increase. Each and every nearby member of the second home is suffering from the cancer. Though that type of guilt feeling is somewhat less, but female always diagnosed late in India till date because of a guilt feeling. They don't go to the physician, or they don't tell their family member, like if mother-in-law is there, she identifies some lump, she will not going to tell her daughter-in-law, "Okay, I have something problem in my breast," or her husband also. So it ultimately lead to diagnose the cancer in advanced stage. So don't feel guilty, don't feel afraid anything. You can identify breast is abnormal, because in initial stage the cancer is painless. So please tell your family member, "I want to check up, that is something abnormal in my breast." Nowadays, Dr. Mukesh already told, in young patient also we identified the breast cancer, particularly in pregnancy and postpartum. It is very difficult stage to diagnose the cancer. If the woman was breastfeeding, they get a lump not resolved by the antibiotic, they should also go for aggressive checkup, because we see a monthly one cases, they identify as a they are milk swelling due to the breastfeeding, and ultimately turn around to be a cancer after few months. So that should be awareness from the patient side is necessary. If they have a lump in with swelling in the breast, not getting rid of the routine treatment within 1 month, they should go for the aggressive investigation.
Right. And Dr. Mukesh, any myth you want to burst for the patients or public listening to us?
Cancer is not a contagious disease. First, second, screening mammography and other areas, they don't give too much of radiation exposure, so that you can no no no, बहुत सारे लोग बोलते हैं कि नहीं ज्यादा पेट तो नहीं कर लिए, ज्यादा सीटी तो नहीं कर लिए, ज्यादा मैमो तो नहीं कर लिया, ऐसे उसका रेडिएशन एक्सपोजर से जो परसेंटेज ऑफ गेटिंग डिसीज दैट इज वेरी लेस, बट इफ यू फाइंड द डिसीज एट एडवांस स्टेज इट इज मोर प्रॉब्लमेटिक. So I think contagiousness of the disease is it's a myth, and second is your exposure to the mammography, low dose radiation exposures, and those doesn't cause much of the trouble anything. And others, I think already Soumya madam and Ankit, Dr. Ankit has already told about the other myths. And definitely cancer is curable even if it's in the early stage, and even its advanced stage. With a good quality of life, we are able to maintain the patients for a longer survival period. So don't hesitate, and whenever the patient first line of
Right.
therapy, you are in the advanced stage 4 situation, don't divide the patient of first line therapy option. You should always give a first line therapy option to the patient, because that patient is important for that family. Even 1 day, 2 days, 10 days, 15 days, 1 month, 2 months, whatever it is in advanced stage, but those days are important for that family. So you should never devoid of giving treatment to advanced stage breast cancer. Also try to give first line of therapy, later you can discuss and plan accordingly.
Right. I think with this message that cancer is not contagious, it is curable when diagnosed early. Get yourself screened, prioritize your health, and self-breast examination is something which can easily be done. Visit the oncologist once you feel that some painless lump is there, because it may be malignant, and it has to be something which has to be diagnosed by the oncologist, by the doctor. Just don't ignore it. With this message, I close this session, and I hope that everyone who's listening to us would be be following what we shared. Thank you all for joining us today in this important discussion.
Thank you, Dr. Manisha. Thank you, Voice of Healthcare, for inviting. It's a wonderful session. Thank you very much. Thank you. It's my pleasure.